Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Memory. Are you having problems with memory? I personally have problems sometimes with where I put certain things at and so forth, or maybe trying to do a crossword puzzle, things like that, trying to relate things, in words and actions and things like this. It's a common thing. A lot of times it has nothing to do with a disease of the brain or anything like this, but there is a condition that is present. We're recognizing it more and more, and that's Alzheimer's disease. Alzheimer's disease, was named after the neurologist who found Alzheimer's, the condition in a patient, and they named it after himself. And we have Dr. Cohn here today that's going to go a little deeper about Alzheimer's disease. What is Alzheimer's disease? It's not just memory, but it has a lot of things to do with social living and other things. So I want to welcome you, Dr. Cohn. Dr. Cohn, just a little background again in your department of psychiatry. What is Alzheimer's disease?
Right. One of the key issues, of course, as you sort of alluded to in your introduction, is what's normal aging and forgetfulness, and what is Alzheimer's disease. Most older people have moments of forgetfulness.
Right.
And as it's sort of like any part of the body. It's your memory starts to deteriorate. Your brain starts to go down a bit as you get older. Mm-hmm. And just like you can't run as fast, your muscles aren't as strong as you get older, your brain isn't quite as strong as it used to be, and there'll be periods where you may forget things. Mm-hmm. And this is acceptable, and we all find ways to compensate for it or laugh about it, and we move on. A lot of us, though, worry if we forget something. Is this the first sign of Alzheimer's disease? Right. And the question is, what is Alzheimer's disease? And Alzheimer's disease is one of several dementias that are present in affecting memory. Mm-hmm. And the key point is that they all affect memory in one way or another, not just short-term, recent memory, but also even there are gaps in long-term memory. But we have so much long-term memory, it's not quite as obvious initially. Right. There's types of dementias, and sometimes now we call them neurocognitive disorders. You may hear that more and more now. Mm-hmm. And cognitive means something that affects one's memory, how one uses language abilities, how one thinks about planning the day and things of that nature, our thinking really. Mm-hmm. And the disorders include, as I said, Alzheimer's, which I'll talk about in a second in some detail, but also vascular dementia, which includes problems of memory secondary to perhaps small little strokes in the brain or narrowing of the vessels in the brain, like arterial sclerosis in the brain, the blood vessels in the brain. Lewy body dementia, which is a type of Parkinson's disease with memory problems. And Parkinson's disease itself may often have memory problems as it progresses. There are causes due to brain tumors. Medical conditions can cause it. It's important to think about these things because some of them are potentially reversible or partially reversible.
I see.
So depression can often mimic dementia as well.
Now just stop there in a moment. The thing is that certain medical diseases like diabetes, for example, are diabetics more prone toward Alzheimer's, or have they found any relationship in that kind of thing?
Well, they're not necessarily Alzheimer's, but certainly vascular dementias for sure. Mm-hmm. Things like diabetes, hypertension, high cholesterol, smoking, all those things can cause changes in the blood vessels in the brain and make you more prone to certainly vascular dementia. And these are also risk factors to some extent for Alzheimer's. So it does. Vascular risk factors do affect your chances of getting Alzheimer's. So they are interrelated. Mm-hmm. And perhaps later in the talk we'll talk about this overlap between these conditions. Okay. They're not as separate as we used to think they were.
Right.
But for the sake of the introduction, I think it's better to kind of separate them out.
Right, surely.
So Alzheimer's, as I said, is one of the dementias. It's really the main dementia that we see. It represents about 70% of dementias. Mm-hmm. Vascular dementias are maybe 15-20%, Lewy body's 15-20%, then the other is a small percent, 10% or so. Alzheimer's, if you were a neuropathologist, you find changes in the brains of these people, specifically these abnormal proteins called senile plaques or these neurofibrillary tangles, which are degeneration of the nerve cells in the brain.
I see.
And that's how we make that diagnosis versus other conditions. Obviously, in a living person, we can't do that, though there are now kind of new techniques that actually can see the plaques in the brains of people, these special kinds of PET scans that can do that. And also some use of cerebral spinal fluid, doing a spinal tap can often give us some idea of these abnormal proteins floating around. They're used sometimes in cases which are very cloudy in terms of diagnosis. They're not typically used, however. Now, Alzheimer's and all dementias, for that matter, are characterized, as I said, by memory problems as the key component, but also people will have language problems. For example, they may have trouble naming things, or they may have trouble understanding things the way they used to. They may have trouble with motor problems, dressing themselves, or learning new motor tasks. They may have trouble recognizing things, objects as well as people. And as the disorder progresses, almost a tragic kind of situation develops where the patient may not recognize the caregiver. So you have this saintly caregiver taking care of this person, and the person says, "You're not my wife, you're not my wife." And it's heartbreaking to the person to see that happen. There are other things, as I mentioned, about planning for the sequencing things and planning things that we typically do to negotiate the world they have trouble with. And finally, a key component is functionality. They can't manage to function the way they used to in terms of daily life. So they, for example, early on they may have trouble shopping or using public transportation, paying their bills, things of that nature. As the disorder progresses, they may have trouble with toileting and bathing and things of that type. Now, we now recognize a milder condition called mild cognitive impairment, sometimes called mild neurocognitive impairment now, where the people have generally some memory problems, objective memory problems on testing, but their functioning still remains pretty good.
I see.
And there's some thinking that some of this progresses to Alzheimer's. Maybe a third progresses to Alzheimer's or other type of dementia. Third kind of just stays the same. And a third, sometimes these people get better. So it's important to distinguish that. And there's a lot of work being done now in trying to focus on the early forms of dementia. If we can intervene early, perhaps we can prevent the disorder. And when we talk about treatment, we can talk more about that.
Right.
But I think that gives you kind of an overview of what the components of Alzheimer's. I might add, though, that many of the people who come in often have behavioral problems, and we call them neuropsychiatric symptoms. They may have agitation, they may have hallucinations or delusions. They get very easily irritated. They may have depression as well, and the family members are very disturbed about this. Of course, they're disturbed about the memory problems, but they're even more disturbed because this person is no longer sociable. They're, they're at home and they're out of control, and they may be up all night. And so one of the things we can do is treat these symptoms. We may not be able to be that successful in treating the memory problems right now, though there are some medications for that. But the behavioral problems we're pretty good at dealing with.
All right. And now, in taking care of these kind of folks at home, it's a social problem as well.
Yes, sir.
And what's your use in this whole department of Alzheimer's disease?
Okay, so my job is to, after the patients are evaluated and diagnosed, and depending on the stage that they are at,
Right.
and the services that are needed,
Right.
I direct the caregivers to the services that are available. For example, if they needed home care, or
Right.
for some patients who need day programs, if they have Medicaid, if they come in with Medicaid, we can direct them on that same day to either for home care or to a day programs.
I see.
Patients who attend the day programs, at night. They generally they sleep better at night. We find that the ones who are up at night, when they attend the day programs,
Right.
when they come back in the afternoon, they are more calmer, and they sleep better at night, and that give the caregivers some respite
I
from
see.
being up at night.
Mhm.
For those who need home care, again, if they come in with Medicaid,
Right.
we apply for home care for them.
I see.
For people who come in who do not have any insurance, some of them may have large assets and homes and all those things.
Right, yes.
We advise the caregivers to, consult with an elder law attorney, because there are options available for, to transfer their assets for them to get the Medicaid. Otherwise, if they qualify right away, we'll direct them to go apply for Medicaid.
I see.
So, without Medicaid, they would have to pay out of pocket, and that is very expensive. So the most important thing when they come in is the patient's safety. And the second is to make sure that they have the proper insurance. And the third is to provide for the caregivers. And so the day program and the home care and all that help, to relieve the stress on the caregivers. But we also have a support group, which is held twice per month, the second and fourth Wednesday of the month, for the caregivers.
How did you get interested? Now, this is a lot of the work you have to do.
Yes.
And your background, maybe a little your background, how you got into
Okay.
this type of thing.
Well, I was
Pardon me, and the last name.
Walcott Brown.
Miss Walker Brown. Right,
Okay,
I'm sorry.
yeah.
I just want folks to know who you are.
Right.
And it's not just another person in the department, but you have a lot of training along the
Right,
lines.
yes. So I was introduced first to Dr. Cohen by a professor
I see.
when I was attending Long Island College.
I see.
And I came in first working as on a study, dementia study,
I see.
with New York University, and that's how I started, interviewing the patients for this study, and that's been like 20 years ago that I
Oh.
began. So I've been with Dr. Cohen for over 20 years, and I've
Wow.
worked in research studies in the community at the clinic. So I'm kind of, over the years I've developed information on Alzheimer's and other dementia.
Yes. And that's
So-
such an important training
Yes.
to have before just being a social worker per se,
Right.
because you have to have all these sensitivities of the home life of the person,
That's right.
where they can get help. And that's so important, that help
Yes, that's very
item.
important,
Yes.
for both the caregiver and the patient. As I said before, the safety of the patient is primary, and also the health of the caregivers, because we find that a lot of caregivers who are providing direct services, they develop a lot of illnesses because they do not get the chance to go to the doctor. And so, we have seen for people who have passed on, after they are gone, the caregiver end up with a lot of health issues because they were not paying attention to, getting the time to go see their doctors to know what's going on physically with them.
Yeah. I making house calls myself. I can't imagine how many people right at home at this moment have beginning Alzheimer's,
Yeah.
who are being set aside in the family rather than taken to a doctor or taken to a clinic or taken to a specialist to be diagnosed and possibly be helped for part of this whole condition.
Yeah.
And I've seen it in the homes where I had to make recommendations because we don't get enough folks coming out to the houses and seeing people who are really ill and disturbing the whole family unit, because everybody gets very anxious
Right.
when they can't go somewhere because that person can't take care of themselves.
Right. And, many caregivers believe that it's a normal part of aging,
Right.
these behaviors. But it's getting better. Dr. Quinn can tell you when I just started, we find that most of the patients came in because they wandered away or they did something and had to
Right.
go to the emergency room.
Surely.
But now, with education and the community over the last 10, 15 years, people are becoming more aware.
Right.
And so we find that many people who come in now really don't have Alzheimer's, but they
Right.
become anxious
Right,
that
yes.
it might be.
Oh, well, that's
It's been a marked change in the, especially in the minority community in
Okay,
Brooklyn.
yes.
When 20 years ago, the minority patients, especially African Americans and African Caribbeans, would come in later in the disorder.
Right, right,
And
right.
often when they had these very disruptive behaviors.
Right, sure.
And had been going on for a number of years, and the family was finally at its wit's end. And we saw, again, whereas the Caucasian patients would come in earlier in the disorder.
Oh, yes.
And though still farther along than we see today. But when we followed up a number of years later, about 2010 we finished the study, there was no racial disparities anymore. The differences had disappeared. The African American, African Caribbeans were coming in at the same time as the Caucasians.
Oh, I see, okay.
Much earlier in the disorder.
Right.
And I think some of it came from, we'd like to think from some of our community outreach, but a lot of it, primary care doctors are much more aware of the condition now.
Right.
And also TV advertisements. You see advertisements
yes.
on TV for Aricept and
yeah, sure.
Exelon, and people are much more aware of what the disorder looks like now when they come in for treatment. Also, visiting nurse service has been very helpful
Right.
in identifying patients. They do a lot of home visits, and now they pick this up very early on.
The visiting nurse service
So,
plays a tremendous role in all of these kind of.
I wanted to emphasize the importance of getting people into things like day programs, and the first thing is they need Medicaid, and that's why it's so important what Lorna does. There's a mythology that if you have a certain amount of assets, you can't possibly get on Medicaid.
Right, yes.
But the reality is that there are ways with a good attorney and not all that expensive to do, to transfer funds or other things that need to be done, so people can secure Medicaid, which buys them a host of services, especially daycare program, but home health aides as well. And it's a relief to the caregiver, but also for the patient. They have activities in the day. We think that helps them cognitively.
Oh, yeah, sure.
Physically, they sleep better. The behavioral problems diminish, so we don't have to use much medication, if
Yes,
any.
right.
So it's very important.
Is the Obamacare, will that make a difference in the care of the patient?
We're not sure how it will play out in New York, which has a very generous Medicaid program.
I see.
Of course, older adults, the vast majority of people we see with Alzheimer's, after all, most of the disorder is primarily a disease of later life. So, I mean, before the age of 65, it's under 1% of people might have the disorder, and it only steadily increases until over the.
Is that throughout the world? Or is that significant for the United States?
No, it's true throughout the world. It's a disorder of old people, and it doesn't even. It starts to peak more in the 80s, really.
I see.
So, so such people, the older adults here in our country have Medicare, so they have some health insurance.
I see.
Which also covers now most medications, but it doesn't cover home care, and that's the difference. You need Medicaid to get home care. Right. And that's, I'm not sure Obamacare or Affordable Health Care Act, as we call, will be able to help on that end. It will vary from state to state. It's an accident of where you live when you develop the disorder. If you live in certain states in the South, your chances of getting home care and entering a day program are very small, and your family has to pay out of pocket. Whereas if you live in New York, you can often get very good, state-of-the-art kind of care.
Well, is Alzheimer's, is it a disease that's brought on by environmental conditions, or is it genetic? Is it, and can it be picked up early with all the gene things we're studying today?
Well, it's all of the above. We do know there's some genetic risk factors, and yes, if it runs in your family, you probably have an increased chance of getting it. There are some gene markers, one that's called this ApoE, And if you have 2 of this ApoE4, your chances of getting it are almost 14 times higher than somebody without it, though it's pretty rare. But even having said that, if you have these ApoE4, you still may not get the disorder. So there's environmental factors. Identical twins don't always get it, certainly at the same time, and there are marked differences in when they may develop it, if at all. So there are certainly environmental factors. The Institute of Medicine did a study and tried to come up with some factors that they think might be preventative. The one that was probably the most significant was exercise.
Oh, okay.
And I always tell patients, I want you to try Does-It-All. And they say, Does-It-All, what's that? And I said, exercise, it does it all. It improves your memory, improves your physical health.
It does, surely.
And it's very important for those who might be watching to think about doing exercise beginning in middle life, or if not sooner. Because the data suggests doing it middle life even has a better chance of helping you maintain brain health as you get older. But any time you start doing it is good. And there have been some reports that even with people with Alzheimer's, those who exercise and get into programs where they exercise don't decline as rapidly. Diets may be another thing. The Mediterranean diet, where people have olive oil and nuts and fruits and things and vegetables and less of the saturated fats.
Do they find that there's a difference in incidence of this condition in the Mediterranean people
there
who have this
seems to
diet?
be data that to support that. It's not quite as strong as exercise, and some studies say yes, some no, but there's increasingly more compelling evidence that this can help as well.
Right. Well, you know what, the toxic things in our foods today, everything from red meat. Is there, for example, Mediterranean is more fish and things
That's
like
correct,
that, and where you have the beef. I wrote an article not long ago. I got a beef about beef. You know, but the thing is that beef being really manufactured now rather than just grown with good grains and things like that. Meat is eaten a lot by folks, and raw and everything else. Hamburgers. Just think of the hamburger joints that we have in our country today, and all across the world now. In China, they have all these different hamburger places and things like this.
As countries gain wealth, people switch from probably somewhat healthier diets of vegetables and to meat. You know, there's some sort of, I guess, maybe we're built to want to crave meat, but it's not necessarily a good thing in terms of certain diseases that you get in wealthier countries, and Alzheimer's may be one component to that.
Yeah, I would like to add, in Jamaica, where I'm from, if you go to Kingston, there are so many McDonald's and Burger Kings and Pizza Hut, and people are not preparing the meal daily as they used to because of all these places that are opened, you know, in the city. And I would also like to add that for people who are reluctant, you know, to do some transfer of assets so they can have Medicaid, that the Alzheimer's Association offers twice per month a financial seminar. And it's open to anyone. People can go and, you know, ask questions if they have concerns.
Well, how would they know where these places are? How would they find out?
Well, for the Alzheimer's Association, they can call 646-744-2900, or they can call me at 28718-287-1124, and I can direct them to, they have educational programs, you know, including the financial aspect where they can go and, you know, have
they also have a website.
And they also have a website.
Let me add one thing that's very important. Lorna's actually represents a partnership between our institution and the New York City Alzheimer's Association. They generously donate her salary. They provide the funding for her salary.
That's wonderful.
And she's part of their kind of outreach program that they've been establishing in especially at-risk areas with at-risk populations, you know, such as minority populations. So we really appreciate what they've done for us, and make a
well, you know, since time is our enemy on programs like this, although we're going to carry on further programs with this, just to bring it all together, Alzheimer's is a disease that's with us. We don't know how long it's going to stay with us, but we're on a road to at least finding some help for it as it goes and maybe discover the cause of it, you know. So I want to thank you, Dr. Scott, to bring up all the information, and certainly we're going to have more programs on this on a regular basis because it is a definite need for this kind of thing. And so you folks out there, Alzheimer's disease is a neurological disease. It affects the brain and memory and other things, behavior patterns and things like that. Might be misdiagnosed as something else, but it is something that's with us. But we do have tremendous care right here at Downstate Medical Care, at Downstate Medical Center, on taking care of the patients. Not only diagnosing it, but also getting folks to live with the condition, or the family to be able to live with the person who might have Alzheimer's. So for any information that you might want to get, maybe you can give it a number again.
718-287-4806, or to reach me at 718-287-1124.
So they could be more personal. What's that, me?
Yes.
Your name?
Lorna Walcott Brown.
So
yes.
You have Miss Brown. You can ask for Miss Brown rather than just somebody on the other line. So we hope to bring more further information on Alzheimer's disease, and we'll see you the next time.